My horse is getting older, 15, and stiffer in his hocks and stifles. He is currently getting a SmartPak for joints, as well as a Devil's Claw Plus for anti-inflammatory. A lot of people, not experts, have told me that he will benefit from joint injections. While I agree that it might help him move better, I am hesitant about the cost-to-benefit ratio. My horse is mainly turned out in a dry lot pasture, ridden lightly in the arena, or out on easy trails 1 to 3 days per week. Is the cost of joint injections going to be practical for his workload? Is there anything else I can add to his routine that may help, be less costly? Just looking for your 2 cents. It's like she's describing me, my horse, and my riding style, so I'm very excited for this answer.
Definitely worth the 2 cents. For this type of horse, where there are multiple things that can be done to make them more comfortable, especially for the type of light work that she's referring to. Certainly joint injections are at the top of the list. If a joint is inflamed and painful, an injection in the joint works better than any other type of treatment. However, that's not the only way to treat that kind of an issue. One of the treatments is already what the horse is on, oral joint supplements. One potential step up in treatment efficacy is a product given in the muscle or in the vein. And that type of medication can help horses with mild to moderate joint stiffness, along with the support of an oral supplement. And that's medication. There are other things other than medication that can be used to help keep a horse more comfortable. You know, some examples would be always take time to warm up the horse. Don't just hop in the saddle and shoot off for the horizon. Just imagine, at least myself, I won't talk about yourself, you know, just getting out of the bus at 6 in the morning at the starting line of the Boston Marathon and just taking off at the starting gun. You can't do that, you know, and one way to empathize with your horse is try that once. On a cold morning, go out and just suddenly go pounding down the pavement. Horses need appropriate warm-up time.
Yeah, I wouldn't be sound if I did that.
So those are some of the aspects. So there's more than just joint injections that can be done.
Well, and especially as to your point as far as the warm-up, her horse is now 15, so things are a little bit different and might need a little bit of an extra warm-up time to get ready to go for exercise.
Absolutely, and warm-up time for most horses is 10 to 15 minutes of light work, you know, not asking collection, not asking lateral work, just nice, free, easy flowing walk.
Okay, so we're thinking she's doing the joint supplement already, potentially doing something, an injection in the muscle for one of those types of medications, and then of course having a joint injection as being another option if we feel we need to go there.
Yes, absolutely.